Hi everyone, Jocelyn here from Right Canada Waterdown. I wanted to jump on here quickly and just review what an audiological assessment entails. I ran a free earwax removal campaign a couple weeks ago, and I was offering free hearing tests, and a lot of people seem to be a little unsure of what a hearing test encompasses. So I just wanted to jump on here and tell you guys. So first, what we're going to do is we're going to bring you into my lovely office. We're going to go through a medical case history. We're going to do a bit of a discovery to better understand your listening needs. We're going to take a look in your ear canals, examining the canal itself and the eardrum. Then what we're going to do is we're going to move you over and we're going to do a quick pressure test on your ears. It's called a tympanogram. Your eardrums vibrate. So we just want to make sure that the eardrums are vibrating the way that they should. We're going to pop you into the sound booth that you can see over here. We're going to put some little tips in your ears. We're going to give you a button, and then we're going to ask that you push the button whenever you hear a beep. We're going to do your right ear, and then we're going to do your left ear. Sometimes we're going to do your left ear, and then we're going to do your right ear. We do them individually, and then we're going to put you through some speech testing, and then we may go back to putting a different headset on you and have you go back to pushing the button whenever you hear a beep. We're going to bring you on out, and we're going to go over your results right then and there. So we're going to review the results of the hearing test, and then we're going to make any sort of recommendations necessary according to your hearing test results. Right there, same day, all done at the same time. And guess what? It's all complimentary. Hope that helps.